So today we're going to dive into a medication that absolutely revolutionized the treatment for a really life-threatening condition. The drug is called Bosentan. And to really get why it's so important, we first have to talk about the problem it was designed to solve.
So, to really understand why this drug is such a big deal, let's just start with a fundamental question. What actually happens when the blood pressure inside your lungs gets dangerously high? I mean, this isn't just a number you see on a machine. It's a condition that puts this crushing, life-threatening strain on your heart.
All right, so this dangerous pressure buildup, that's the core of the disease Bosentan was made to fight.
Okay, so what we're talking about here is a condition called Pulmonary Arterial Hypertension, or PAH for short. Now, this isn't your typical high blood pressure. It specifically targets the arteries in the lungs. Imagine the pipes carrying blood through your lungs. What if they started squeezing shut? The right side of your heart has to work like crazy just to force blood through. And over time, that kind of relentless strain, well, it can lead to heart failure.
You know, in every good medical story, you've got a villain, right? A biological bad guy. And in the story of PAH, our villain is this really potent chemical your own body makes, and it's called endothelin 1.
So in someone with PAH, their body is just churning out way too much endothelin 1, and this stuff goes on a rampage. A two-pronged attack, really. First, it squeezes the blood vessels, causing them to narrow. That's constriction. But at the same time, it actually causes the vessel walls to get thicker, making them stiff and even narrower. It's just a perfect storm for dangerously high pressure.
So, if endothelin 1 is our villain, what we need is a hero, right? Something that can stop it dead in its tracks. And that brings us to the solution, unlocking those arteries.
And that hero is Bosentan. It's honestly hard to overstate what a massive breakthrough this was. I mean, before Bosentan, treatments were often super complex, even invasive. We're talking continuous IV pumps. So the idea of an effective pill you could take, wow, that was a total game changer for patients and doctors alike.
Okay, so how does this thing actually work? Well, it's actually a really clever, targeted strategy. Think of endothelin 1 as needing to plug into these little docking stations, we call them receptors, on your blood vessels to do its damage. What Bosentan does is it races ahead and basically parks in all those spots first, blocking them off. With nowhere to dock, endothelin 1 is just powerless. The blood vessels can finally relax, and that massive pressure on the heart starts to come down.
Yeah, here's a perfect way to think about it. If endothelin 1 is the key trying to turn the lock and cause all that constriction, Bosentan is like someone who gets there first and jams the keyhole. The bad key can't even get in. So that's the science, but what does it actually mean for a person living with this condition? Well, it means real, tangible, life-altering improvements. People are able to walk further, their ability to exercise gets better, and maybe most importantly, the drug helps slow down the progression of the disease, which means keeping people feeling better and out of the hospital for longer.
But, and you probably knew there was a but coming, right? A drug this powerful is almost never without risk. And with Bosentan, the complications are really serious. They demand huge respect and a ton of caution from everybody involved.
So you've got risks on a couple of different levels here. On one hand, you have the more common manageable stuff, headaches, feeling flushed. But on the other hand, you have these really high stakes risks, the kind of thing that requires a whole safety system to be built around the drug.
All right, let's zero in on the number one risk, liver toxicity. Bosentan can really irritate the liver, causing it to release certain enzymes into the blood. Think of those enzymes as a red flag, a warning siren that the liver is under stress and could be getting damaged. This is not a small thing. It is the central safety concern for this medication.
And then there's the second major risk. And this one is so severe it comes with an absolute ironclad rule. Bosentan is what's called a pregnancy category X drug. That's the FDA's highest possible warning level. It means we know it causes severe birth defects, no question. And because of that, any female patient taking this has to be on 2 separate, reliable forms of contraception the entire time. Okay, so because of these 2 huge risks, the liver damage and the birth defects, there's a very strict safety playbook that everyone has to follow. And this isn't a suggestion, it's absolutely mandatory. This mandatory playbook has a name. It's called a REMS program, which stands for Risk Evaluation and Mitigation Strategy. It's basically a special set of rules the FDA requires for certain high-risk drugs, all to make sure the benefits are always worth the very real dangers.
And the rules are tight.
Your family doctor can't just write you a prescription. No, they have to be specially enrolled in this program. Your local pharmacy, same deal. They have to be enrolled too. And the patient has to be enrolled and officially say, yes, I understand the risks. And the cornerstone of all of this? Those mandatory blood tests every single month to keep a close eye on the liver.
And on top of all that, you have to be incredibly careful about other medications. I mean, some combos are completely off the table, what we call contraindicated, meaning you just never ever take them together. This includes drugs like cyclosporin and glyburide because the risk of liver injury is just too high. And this is so critical. Bosentan can make hormonal contraceptives, like the pill, less effective. This is exactly why that second form of birth control isn't just a good idea, it's essential.
All right, so we've been through the problem, this amazing solution, and all the serious risks. So what's the big picture here? What's the final takeaway?
It really boils down to this. Bosentan is, no question, a powerful, even revolutionary tool in the fight against PAH. It gives people real hope and a better quality of life. But it's a tool that demands constant vigilance. It demands strict adherence to the rules and a deep respect for its power. It's really a perfect example of that tightrope walk in modern medicine, you know? The one between incredible benefit and very significant risk.